we're ready.
All right. First of all, on behalf of Visiting Angels and 125 Live, we want to thank all of you for zooming in to attend our first seminar like this with Zoom. Obviously, we've had to change a lot of things over the last couple of months with what's going on out there. It's great to see some familiar faces. I really do appreciate you guys coming in. I think we have a great session for you this morning. This was not the initial way we planned on presenting this, but I think it'll work out very well. We have with us this morning Amy Swain, Dr. Amy Swain from Amy Swain Hearing Centers. Amy is going to be talking about, the title of this presentation is, What Did You Say? And as most of us know, as we age, we have some effect to our hearing, or a lot of us have some effect to our hearing. So Amy's going to talk to us about better hearing and better quality of life can be yours for many years if you do the things that you need to do. Amy and her team service Rochester, Austin, Owatonna, and Wabasha area. So with that, I'm going to turn it over to Amy. And I would, a couple of housekeeping things. There is a mute button on your screen. If you would go ahead and mute your session while this is going on. At the end or during the session, if you have some questions, there is a chat feature. You can type in your questions. Otherwise, at the end, we'll unmute and let people have a chance to ask questions and talk. So without further ado, Amy, take it away.
Okay. Well, hi. I don't know, can people see me now or am I just a voice? It doesn't matter one way or the other.
Right now, you're just a voice, Amy.
Okay. And just to let you know, it's Rochester, Owatonna, Austin, and Waseca. I don't go up to Wabasha, but that's okay. So I just wanted to correct that. I'm a local person. I grew up on a farm over by Owatonna, and I got my degree, undergraduate and graduate degree at the University of Minnesota. And then I went on and got my doctorate degree about 10 years ago from University of Arizona. So I've been doing this for 30 years, though. I've been dealing with hearing aids and helping people hear better for 30 years. I want to talk a little bit about hearing loss first and how it's very possible that a person has a hearing loss and doesn't even know it. And so I wanted to start off with a little bit of a joke. A man went in to see his doctor, and he was concerned about his wife and how she could not hear. And so the doctor gave him some tips as to how he could test her hearing to see if she could hear. And so what he did was he started walking behind his wife. He was about 10, 12 feet away from her while she had her back to him. And he said, "Honey, I love you." And she didn't respond. So he took a few steps closer to her and said, "Honey, I love you." And she still didn't respond. And so he took a few steps closer, and right now he's right behind her, and he says, "Honey, I love you." She turned around and she said, "For the third time, I love you too." So it's very possible a person has a hearing loss and doesn't even know it themselves, because other people notice it before the person themselves. So why would you want to fix that? I want to go through this whole presentation is why would you want to fix your hearing loss if you have one? Well, first of all, not only does it improve the quality of life, but there's other factors involved. So the first thing you want to know is, how do you know if you have a hearing loss? And we'll go to the next slide here.
Okay, slide 2.
Okay, so signs of a hearing loss. First of all, when you start asking people to repeat. And you'll kind of know that when you do start asking people to repeat, they might answer you once or twice. And then at some point, they're going to say, "Oh, just forget it, never mind." That's when they become frustrated. a lot of times somebody with a hearing loss will say, I can hear people talking, but I can't understand the words. The reason for that is the clarity is quite often lost first before a total hearing loss is evident. And what I mean by that is you might be able to hear in the lower pitched sounds, but you might not hear the high frequency sounds like the S, the K, the P, the TH, those types of things. When you're not hearing that, words like sake, take, flake, fake, cake, you can hear that A because that's a low frequency, lower pitched sound, but those high frequencies aren't being heard. So what you're hearing is a, yay. That's what people mean when they say they can hear someone talking, but they can't understand the words. That's a sign of a hearing loss. When you have trouble hearing in groups, you're in a group of people and it just sounds like, you're not hearing the words. Again, that's a sign of a hearing loss. If you're turning the TV or radio louder than others would like, usually people will let you know that. That's also a sign. And your friends and family have told you. I don't know how many times people come in and the wife has said, he's driving me nuts, he can't hear, or sons and daughters will come in, he can't hear, or she can't hear. But that's, pay attention to what people are telling you, because they're not saying it to be mean, they're saying it because they notice you're not hearing well. Next slide. So if you think you have a hearing loss, please have your hearing tested by an audiologist. There's a lot of people out there selling hearing aids that don't have a degree in audiology. They're simply trained by a manufacturing company to do hearing tests and to sell hearing aids. Audiologists are the only ones that can diagnose your hearing loss legally. And there are many people out there that sell those aids that are not audiologists, and they don't have the training to determine what might be wrong. For instance, go to the next slide. It was supposed to say, okay, audiologists are going to notice whether you have earwax. They're going to notice whether you have a medical condition that needs to be treated, and they would send you off to the doctor. They're the ones at the front that are going to know that there's something else that needs to be done besides getting a hearing aid. So if you have a hearing aid, what happens if you have a hearing loss? I mean, if you have a hearing aid, if you have a hearing loss, what happens when you have a hearing loss? You need to use hearing aids. If you don't treat it, then you have what they call is untreated hearing loss. And that means not wearing hearing aids when they're recommended to you. So what happens? Next slide. First of all, emotional issues or things like isolation and depression can happen. People decide they don't want to go out and socialize because they don't hear what's going on. They're at a party, people start laughing, they don't know what the joke is, and so they isolate themselves. If they avoid the conversations, if they avoid the social settings, then they don't have to worry about not being able to hear. Loneliness, because they stay at home more, they might get paranoid that people are talking about them. They end up starting to lack self-confidence because they're not sure what's being talked about or if people are talking about them. And then family and friends become frustrated. So that's just the beginning of a hearing loss. There are other things. Next slide. Things like the relationship between dementia and hearing loss. If you have a hearing loss and you don't treat it with the use of hearing aids, you are more likely to end up having problems with dementia or cognitive issues. So on this screen, it shows you that a mild hearing loss, you're 2 times more likely to develop dementia. 3 times, if it's a moderate loss, 3 times more likely. And then if you have a severe loss, 5 times more likely. Anybody that's going in or being asked by their doctor to have a hearing test done to find out if they have dementia, they should also insist on having a hearing loss, because quite frankly, sometimes people will say they have problems with their memory, but is it problems with their memory or are they just not hearing it? So get the hearing test first and then have the test for the dementia. But keep in mind, there is a relationship. So if you have a hearing loss, it's very important to get hearing aids to try to keep your mind working and everything they always say, exercise your mind. If you think you're having a cognitive issue or you think you're getting dementia, exercise that mind. Next slide. Other issues that happen is that if you have a hearing loss, you're using your brain to work harder to hear conversations, you're using your brain harder to hear noises.
Wow.
And you overtax your system. And when you overtax your system, you're more likely to fall. So even if you have a slight decrease in your hearing, you are 3 times more likely to fall. And as the hearing loss gets more severe, the chances of you falling are increased. And that leads to all kinds of issues. You get a broken hip and you end up in the hospital, or you end up in a nursing home. So this is important. There's a direct connection to this. Many studies have been done. Next slide. Another issue is auditory deprivation. If you have a hearing loss and you choose not to get hearing aids, your brain pretty much forgets how to understand the words. What it says here, when hearing loss is ignored and left untreated, the auditory system is deprived of sound. Depriving the hearing system of sound results in atrophy of the auditory nerves and speech processing areas of the brain. This atrophy is called auditory deprivation. Once auditory deprivation has taken place, restoring hearing through the use of hearing aids becomes much more difficult. What I mean by that is, in a hearing test, when you go to get your hearing tested, an audiologist is going to find out how loud the sounds have to be in order for you to hear them. So those are the different pitches. But then we will also do a test that we call word discrimination testing. What we're doing is we're having a recording and it says, say the word dog, say the word king, and we ask that you repeat those words back. What we'll find when somebody has a severe hearing loss and they've never worn hearing aids, quite often we'll find that they are unable to distinguish those words. And so when they say the word dog, and the person says blah, they didn't understand the word, they didn't hear it clearly. Hearing aids can't correct that. That's auditory deprivation. And that's when it becomes hard to work with somebody with hearing aids, because things don't come in clearly for them. Next slide. So some other reasons you might want to have your hearing tested is, if you have diabetes, you really should have it tested, because you're more likely to have hearing loss. This is because of how the disease progresses in your body. There's less blood and energy getting into the hearing nerves, and it can actually cause more hearing loss. Next slide. Other reasons you might want to have your hearing tested, because they could have an effect on your hearing, is if you have heart disease, because again, the blood supply to the ear. Osteoporosis, because there's little bones in your ear that might be affecting your hearing. So you might want to have your hearing tested if you have osteoporosis. If you're taking chemotherapy, that can have a dramatic effect on your hearing. So you'd want to have your hearing tested more often. And then antibiotics, streptomycin, amoxicillin, those types of things can all have an effect on your hearing loss, or on your hearing. So they can cause hearing loss. And so therefore, if you're on antibiotics quite often, you might want to have your hearing tested more frequently. Next slide. So you have a hearing loss. Where do you go and which hearing aid is best? I know this is what everybody wants to know, is which hearing aid is best. So next slide. I recommend seeing an audiologist who works with more than one brand of hearing aid. That person is a professional that is choosing one that works best for you. Now, just for an example, I might choose a product over another brand because it offers something that that person wants or needs. I had a client, for example, who goes to a lot of plays, goes to the Owatonna Little Theater, which has a loop. And so what they would want in their hearing aid, and it might not mean anything to you, but what they might want in a hearing aid is a T-coil, because that's an activity that they do quite frequently. Recently, T-coils have been taken out of hearing aids because they work with cell phones so often that people aren't using the T-coil for just a regular landline at home. But if this particular individual enjoys going to plays at the Watana Little Theater that is looped for T-coils, I want them to have a T-coil. So saying that, not every brand has a T-coil. So I might change my mind from what one person is fit to a different product for a different person. So even when somebody comes in my office and says, I want a Phonak hearing aid, or I want a Starkey hearing aid because my friend has it, I might say, well, just hold on, let's talk about this, because there might be something that works better for your lifestyle than what your friend has. So definitely see an audiologist. They have the experience, they have the education, but also go someplace where they recommend more than one brand of hearing aid. Most offices out there will work with only one brand. Next slide. Okay, here's questions to ask when you're scheduling an appointment to purchase hearing aids. Next slide. You want to ask, will I see an audiologist? You want to ask, do you sell mostly one brand? Have them ask it that way. So they say, yeah, we usually sell this one. 3, can you just walk into the clinic and get help with a problem, or do you need to wait for an appointment? Some of the larger clinics, they have good professionals there, but I've seen on a desk somewhere that if you drop your hearing aid off, we'll get back to you in 48 hours. That's not acceptable. If you're having a hearing aid problem, it's just plugged with earwax, it's not working, you want to be able to walk in and get help with your hearing aid right away. Next slide. Most importantly, you want to ask, are the hearing aids you sell locked? What I mean by that is there are many people out there selling hearing aids when they sell only one brand, and it's usually a franchise name, a very popular franchise name, and those hearing aids are locked so that when somebody's having a hard time and they're not getting the help they need when they purchase their hearing aid, I quite often have people come into my office and ask me to help program their hearing aids so it's set up properly for their hearing loss. Unfortunately, a lot of these franchises will lock their hearing aids so another practitioner cannot work with that patient. When I can't work with them, all I can say is I can't help you with those hearing aids. You'd have to get different ones for me to help you. When you go to an audiologist that sells more than one brand, you'll find that none of those hearing aids are locked. The other thing is when you say if they're locked, you also can say, can I see someone else for reprogramming later on if it doesn't work out? And then the next slide is what you want to ask them about is their return policy. Please keep in mind, because not everybody out there will tell you this, but Minnesota law, this means everybody out there has to allow you 45 days to return hearing aids. Quite often the clinic is allowed to keep a fee of $250, which is, you know, they spent time with you, they paid postage to get the hearing aids in for you to try. So there is a fee of $250 for most clinics, but you do have a right to return those hearing aids within 45 days. Don't ever let them tell you that you don't. Next slide. Can I save money by buying hearing aids on the internet? Next slide. I'm going to give you 5 reasons why not to buy the hearing aids online. Number 1, audiologist is going to be able to discover medical contraindications. I can't talk today. Contraindications such as earwax, ear infections, otosclerosis, and other ear diseases. You want to have those checked out before you purchase a hearing aid. Don't go online and assume there's nothing medically wrong with you or there's not a reason to not have a hearing aid for you. Please get that checked out first. Don't just take a test online. There's a lot of hearing evaluations you can have online. That's just not the way to go about it. Number 2, you might not get an accurate test and you might not get a good fit to the hearing aid because one size does not fit all. You want to see an audiologist, you want to see a professional to make sure you're going to get an accurate test. Next slide. Coaching and support. With hearing aids, there's definitely a period of time where you're going to need help learning how to wear the hearing aids, taking the time to understand what's expected when you first get them, and learning how to care for them. If they get plugged up with wax, how do you clean that out? You need to have somebody coach you and support you every step of the way the first few months until you kind of understand and you get comfortable wearing the hearing aids. You're going to need ongoing support. If 6 months down the line or a year from now, the hearing aids aren't working, where are you going to go for help if you bought them online? You're going to have to mail them back to the person you purchased them from to get that help. Next slide. Last reason for not buying hearing aids online is you get what you pay for. You might save money now, but you also might get hearing aids that are improperly programmed, don't fit properly, or stop working. In the end, you don't save money. You just end up with an issue and you end up having to go someplace to get a professional opinion, a professional fit. Next line, or next slide. Okay, so everybody always wants to know what's new in hearing aids. Next slide. Many of you might already know this, but of course, hearing aids today have a much better sound quality and much better noise reduction than they used to have. Every year, products come out and they get better and better. Next slide. They are not your parents' hearing aid. You certainly don't want to be wearing that. Next slide. Here's some discrete style ones. They go in your ear. They're not as popular as they used to be, partly because when you put the hearing aid down in your ear like this and you have a really teeny tiny one, it does change the way your voice sounds. Most people will say their voice sounds like they're talking in a barrel, or it sounds kind of tinny. So another style that's become very popular that's very discreet is on the next slide. And that is the open fit product. You see the little wire going down to the ear. There's a little speaker down into the ear. The hearing aid is sitting over the top of the ear. Very discreet. If you have a little bit of hair, and even if you don't have a little bit of hair, it's very hard to see these, especially if somebody's looking at you face on. Next slide. So some of the things that are happening with hearing aids, of course, is the use of cell phones. You can download apps on your cell phones. The iPhone is the easiest one to work with and works with every brand of hearing aid. Androids, some of the hearing aid products are being able to be used for this too. You just have to ask your hearing provider, does my cell phone work with my hearing aids? But for the most part, you can download apps that allow you to use the cell phones as a remote control for your hearing aids. They also allow the ability to stream phone calls and music to your hearing aids. So when somebody calls, you answer your phone and you actually hear the conversation in your hearing aids. Makes it much easier to understand the conversations, especially because you can hear it in both ears. Whereas on a regular phone, you're just using one ear to hear the speaker on the phone. A lot of the products, in fact, I can't think of a single one out there that doesn't have an extra TV streamer you can get. It's a little box. You plug it into the back of your TV and it'll directly stream the sound to your hearing aids. Lastly, another new thing that's come up is the rechargeability of hearing aids. Not having to change the batteries and that type of thing. There's almost every company out there now has a rechargeable battery. The ones in the past were never really good. Now they're using a lithium-ion battery. But if we look at the next slide, I'm going to tell you some pros and cons about rechargeability. Oh, before I get to the rechargeable, I forget what order my slides are in here, so forgive me for that. But here, I want to tell you that there's even some hearing aids that can track your steps throughout the day, like a Fitbit or that type of thing. So it can kind of monitor, you know, your exercise levels. And it can also signal to your family members if you fall. Almost like a lifeline type of thing, but I wouldn't substitute it for a lifeline because most people fall in the middle of the night when they get up to go get water or go to the bathroom. So I wouldn't use the hearing aid for that reason, but some hearing aids do allow family members to know if you fell. Hearing aids also can translate different languages for you. That's in one particular brand. You can also use apps to do this, But all of these things are with the use of a cell phone. If you don't have a cell phone like an iPhone or an Android, you're not going to be able to do these types of things. But these are some of the new things that are coming out in hearing aids today. Next slide. Here's a picture of some of the apps I have here. It's kind of hard to see maybe unless you have a big screen, but you're able to give yourself different programs. Like if you're going into a noisy environment, you can hit the restaurant mode. If you're in the car and you're having a hard time hearing because of the tire noise, you can hit that car icon. If you're outside and the wind noise is a problem, you could hit the outdoor mode. You can also change the volume and that type of thing from your iPhone or from your Android cell phone. If you have an iWatch, you can do it on your iWatch as well. So this is how far things are going, is you can take your phone calls through your hearing aids, and you can change the settings on your hearing aids, and you can change the volume, all through the use of your phone or your iWatch if you have one. Next screen. Here's just another picture of another app, a different company. I just wanted to throw out, I didn't want to just put one picture up of one company. Here again, you see the volume control as well as the different programs you can use on the hearing aids. The next screen is another company. This one's kind of interesting because if you're in a restaurant and it's really, really noisy, what you can do is focus the hearing aid so that it goes just directly face forward. You're going to reduce everything that's around you, just like the little picture there with the arrow. The little blue center area is what you could focus in. So like say you're at Applebee's and it's really noisy, you can reduce the people talking behind you, you can reduce the people talking on the sides, and focus more on the person that you're with. Next slide. Here's another screen. This is how sophisticated it can get. Now, mind you, when it comes to these apps, sometimes I will pick one brand over another because the apps that are used by the company, some of them are simpler and easier to use, and some people want to have all the control in the world. This particular app is from a company called Widex, and on the left you see is your volume control. You can change the volume of the right or the left hearing aid. The next slide is like an equalizer on a stereo where you can change the pitch of it. So if somebody has all of a sudden a high cackling laugh, you can turn down the high frequencies. The sound mixer just allows you to do kind of the same thing, but also allowing you to reduce some of the background noise or to bring in more of what the hearing aid is hearing or more of the outside noise. And again, the sound direction, you saw that on the screen before, where you can decide, I want to hear on the right side, I want to hear on the left side, I want to hear what's in front of me. So these apps can be very sophisticated, allowing the user to have a lot of control. The audiologist limits how much you can do, but it allows you to be able to change according to your environment. When you go into a party type atmosphere or versus a restaurant versus a quiet area. Next slide. Here's all the charging units of just a few companies. You just put the hearing aids into the charging unit for the night, and then you never have to change batteries. Most of these have a warranty that goes about 3 years. Before that 3 years was up, you might want to send the hearing aids in, make sure that lithium-ion battery is going to last you longer. Hearing aids generally last 5 or 6 years, and if the battery only lasts 3 years, you might have to have the battery replaced. But these are just a few examples of charging units. They can be handy. Some of them allow you to unplug and not use the cord if you travel out of town for a weekend. Some of them do not. That's something you might want to bring up to your audiologist if you're wanting to travel a lot, because there's options that make it a little easier to travel rather than carrying the bigger cases around. Next slide. I just want to talk about, excuse me, the advantages and disadvantages of rechargeable batteries. First of all, the advantages of rechargeable batteries is because these newer hearing aids, like when I first started, a battery could last a month in a hearing aid. Now they only last about 3 or 4 days. So one of the advantages of having rechargeable batteries is because regular batteries only last a few days, you're not having to go out and buy the batteries all the time. You're not having to change the batteries. The batteries are small, so if you have problems with dexterity, having a rechargeable hearing aid would be an advantage for you. So yeah, not having to change them, not having to buy them, it just makes it easier. But there's also disadvantages to the rechargeable batteries. Let's look at the next slide. Disadvantage, the rechargeable batteries, the lithium ions, are only guaranteed for 3 years. That means at the end of 3 years, if you haven't sent the hearing aids back to the manufacturer, and that usually takes about a week, if you haven't sent it in to have it checked, then at 3.5 years or 4 years, you may have to send your hearing aids in to have that replaced, and there would be a charge for that. So you want to be aware that the rechargeable batteries are only guaranteed for 3 years, and you cannot change those batteries out yourself. It's a lithium ion battery, which is a form of poison. They are completely sealed into the hearing aid. If you forget to charge your batteries, then you might be without your hearing aids for the day. So that's a disadvantage. Whereas just using a regular battery, you just pop it in there. The batteries or the charger do not work then the hearing aids need to be sent for repair rather than just putting a new battery in. To me, that's a disadvantage. It's real nice to just have a pack of batteries in your purse or in your car or in your wallet and just change the battery. Another disadvantage is having to pack the charging unit when you're traveling. Just one more thing to pack. If you have your cell phone, you're packing your charger for that. You're packing your charger for the hearing aids as well. So there's pros and cons to rechargeability, but most people would say it's pretty convenient. Next slide. So there's a lot of decisions to be made, but once you get the hearing aids, shouldn't you be able to hear everything? People will come to me and say, gosh, I spent a lot of money on these and I still couldn't hear when I was at this party. Well, what was the background noise like? What was going on? Did somebody laugh really loud next to you? Even if I have normal hearing, I'm going to miss things. And so you're not always going to hear everything when you have hearing aids. Sometimes you have to do things that makes it easier to hear. Next slide. Hearing aids can improve your hearing, but they can't restore it. So if you know someone with a hearing loss, there are ways you can help them to hear better. So this is important. I want to pass this on to every spouse, every family member that's out there that is close to someone that has a hearing loss, whether they wear hearing aids or not. Next slide. Okay, so this I kind of thought was a little funny. It says, I can't hear you, so I'll just laugh and hope it wasn't a question. So what I want to say here is talk about tips on speaking to someone that has a hearing loss, even if they wear hearing aids. Next slide. It is very important that you get somebody's attention so that they are ready to listen to you. That means saying, hey, Ralph, and then he turns and looks at you. Now you've got his attention. He is better able to hear you. If you are in a room and somebody's watching TV or they're looking at a magazine or reading a book and you just start talking, they may miss the first part of what you say, so you're going to have to repeat it. And that's whether somebody has normal hearing, working hearing aids, or just a hearing loss. Get their attention. Next. Face the person you're speaking to. So if you're chopping up something at the kitchen counter and you're talking while you're chopping and you're looking down, they're not likely to hear you as well. Turn around and face the person you're speaking to. They will have a better chance of understanding you. Speak naturally, so don't try to enunciate too much. Just speak naturally, but maybe speak a little bit slower, but it doesn't necessarily have to be louder. Another thing you can do is rephrase. If you say, for instance, get the butter out of the refrigerator, and you say it 2 or 3 times and they don't understand it, maybe just point to the refrigerator and rephrase saying, I need butter, or just say it in a different way so that they understand it. Don't change topics abruptly. Like right now, it would be real funny for me to all of a sudden start telling you how to cook rice, rather than talking about hearing aids and hearing loss. If you're going to change topics, somehow let it be known you're changing topics either with some kind of visual cue, something in your hand, or just slowly start talking about something else. Turn off background noise if possible. Running water is like one of the worst. People stand by the sink is running, the water's running, and they start talking. People can't hear you well. Next slide. Turn on the lights or move to a place where there's more light. That definitely helps. If you're sitting in a dim lit place, they can't see your face, it's harder to do any lip reading. If you're going to go out to eat, choose a quiet restaurant. They can sit in a back corner and face you, but if they wear hearing aids, it's actually better if the person with the hearing loss and the hearing aids is sitting where to the back of them is where the noise is at, because then they can turn their hearing aids to the restaurant mode and reduce the restaurant noise that's coming from behind them. If you have a question on that, you can ask me, but basically they'd press a button on the hearing aid or a button on their phone, and it reduces the noise behind them, which makes it easier at a restaurant. If you live with somebody with a hearing loss, don't try to speak to them from another room. Even if you have normal hearing, it's hard to hear somebody from another room, so try to go to the room that they're in. Also, don't cover your mouth with your hand. That makes it hard to hear you. Always keep your hands away from your mouth. If you are close to someone with a hearing loss and you have a mustache, consider shaving. Being able to read somebody's lips makes it a whole lot easier to hear. Next slide. If you're with a group of people, try to encourage one person to speak at a time. You know what I'm saying. If there's 8 people at the table and there's 3 conversations going, it's very difficult for someone with a hearing loss to hear. So try to say, hey, let's just one person talk. Don't drop your voice at the end of the sentences. You want to keep your voice loud and clear the whole time you're talking. Start by making the topic of conversation clear with visuals or facial expressions. And last but not least, don't get frustrated or impatient. If necessary, use a pen and paper. Next slide. In summary, if you think you have a hearing loss, get your hearing tested by an audiologist. Untreated hearing loss can lead to other health issues, both physical and emotional. Hearing aids today are better than they used to be. Be sure and ask questions when purchasing hearing aids. Next slide. Any questions?
Well, Amy, this is Doug. I know that Cheryl from 125 Live wanted, she had typed in the chat thing here that 125 Live has a T-coil system. Could you address that and how it works?
Okay, the T-coil. Let me start with talking about the history of hearing aids. When the first digital hearing aids came on the market, all of the sound was supposed to be automatically adjusted to be louder and softer and that type of thing. So the hearing industry took the volume controls off of hearing aids, but people wanted them, so they had to put them back. Now T-coils are a little special wire that works with a magnet in landlines. It's in a phone. And so when you put the phone up to your ear, what you hear is a direct signal from the phone. So you don't hear anything else except what's on the phone. Same with when they loop a room with a telecoil, they loop a room. And so if someone has a hearing aid on, they're going to be able to hear, like if that telecoil is hooked up to a TV or if it's hooked up to a microphone or anything, they're going to hear only what's coming through the microphone, which is really nice because it gets rid of all the background noise. It gives you a direct signal from the speaker. Some of the theaters, like the Owatonna Little Theater, I think the Guthrie was getting one, they're looping. And so the T-coil has become very popular because it allows you to get that direct signal. It allows you to hear it in both ears. It's very, very nice for hearing. However, when when the manufacturers started having the hearing aids work with cell phones, they assumed nobody needed the T-coil anymore for the landlines. So now they started taking out the T-coil. So when somebody wants to enjoy the use of a T-coil on their hearing aid, like the Live 125 has that, a room looped for that, if you don't have a T-coil, you can't use that system. So there's a period of about 5-6 years here now where they've stopped putting T-coils in the hearing aids. Now they're starting to put them back in, just like with the volume controls. So if that's an area that you go to and you use a T-coil, like even the Owatonna Library has a looped room, that's something to talk to your audiologist about, because not all hearing aids out there now have T-coils. So you want to ask for that to make sure you get it. Hopefully your audiologist will ask you about it.
We had another question about Bluetooth. Is that the same as T-coil?
No, Bluetooth is wireless. So if you have an iPhone or an Android, you can use Bluetooth to hear anything that's being played. Like for instance, right now I'm on my iPad. If I had hearing aids in and I wanted to use it to hear this presentation, it would be wireless and I would hear that coming right through my hearing aids. And so the Bluetooth works with your cell phone, your iPhone, some computers, iPads, all of that stuff. And you don't need any cords or anything in there. You don't need any extra headphones. You don't have to use anything extra. It works directly with the hearing aids.
So there was another question also about now when we have to wear masks. What are your thoughts and recommendations? Obviously, if we're wearing masks, you can't read lips like you could otherwise.
Yes, and I have on back order. I have some clear masks I'm trying to get so that people can hear me, because I'm struggling now and I'm not technically open, but I do see people for dead hearing aids and hearing aids that need to be fixed and that kind of thing. We're seeing some people that are in dire straits of getting new hearing aids, but we're keeping it very limited. But we're having a difficult time getting our patients to hear us with our masks on. So yes, I ordered clear masks so they can hear me, but yeah, that is a problem. I don't have an easy answer for that. Maybe a face shield. If you live with somebody that's very close to you, a face shield would be better than nothing. The masks still are, because the face shield, you can get air underneath. So the masks are still basically necessary, but yeah, a clear mask would be nice. And those are probably going to be becoming more prevalent.
And then I have a question for you. You mentioned seeing patients. Any idea on when you're going to be able to be open to see patients? I see that Mayo Clinic announced this morning they're going to be starting to take some, doing some procedures now that are elective procedures.
Yes. Throughout this whole stay-at-home time, I've monitored all my calls into the office, taking messages. And what we're doing is we're open just a few hours each day at some of the locations, because we have 4 of them. So we kind of sporadically do that. If somebody's got a dead hearing aid, needs batteries, that type of thing, we ask them to stay in their car. We come out to them and we take care of them as much as we can without them coming into the office. When somebody needs a hearing aid, they come into the office, and we have seen a few people. They come in the office, we sanitize their hands, we have them wear a mask, we wear a mask, we wear gloves, we treat the people, and then we clean everything down after they leave. So everything's wiped down before they come in, wiped down when they go. We can't see as many people because you got to have that time in between to clean. But I'm hoping maybe next week, if the shelter at home is lifted, that maybe we can start seeing more patients. But right now, we ask people to call in, and we screen, and we go through all these extra steps.
Okay, thank you for that. Another question that was asked, typed in here was, how often do you recommend a single hearing aid versus a pair?
Very rarely. There are many things about wearing 2 hearing aids that is helpful. Number one, you definitely hear better in a noisy place. You're going to have better localization abilities, knowing where the sound came from. If you only wear one, you do risk auditory deprivation on the one hearing aid that doesn't have a hearing aid in it. Sometimes we get somebody where the hearing loss is so bad that they can't use a hearing aid on one side. And in that case, we would recommend what we call a bicross. The bicross looks like two hearing aids, but the side where they have no hearing is just a microphone, and that microphone transmits the sound to the good ear. So I can't honestly tell you the last time I fit somebody to just one hearing aid. It's very, very, very rare. It would only be if they can't use that ear for a hearing aid, and then I would recommend the bicross.
Okay. Another question here from Terry. My dad can't hear my sister anymore. He needs to see ENT before the audiologist can test his hearing and possibly adjust his aids. But this primary visit was canceled, so he can't get a referral to an ENT. He is 97. Should we just give up on talking to him? I have a low-pitched voice, and he can still hear about a third of my conversation.
I guess that question I'd have to know more about. Why does he have to see an ENT before seeing the audiologist?
Yeah, hair and some blood in one ear. He had a tube in it, he says.
Oh, he has a tube in one of the ears.
He doesn't know if it's there anymore. It was
Well,
supposed to dissolve or something.
Yeah, sometimes the tubes fall out, sometimes they dissolve. We see that quite often. An audiologist would be able to look in there and tell you whether the tube's in place or not. They also would be able to tell you, because usually the tube is put in place to drain fluid. The audiologist would do a test to make sure there's no fluid behind the eardrum. So you could probably go directly to the audiologist and check that all out. If the audiologist feels it's necessary to see the ENT, then you would maybe have to wait, but you might not have to wait. We could check and see if the tube is still draining. We can check and see if there's fluid behind the eardrum. We can check all of that and let you know if it's necessary to see the ENT.
Okay, thank you. Let me see. I think we have one more question here. What about using headphones? Apple, iPod, Pro, etc.
Well, to use them for in substitute of a hearing aid?
No, and in addition to using a hearing aid.
I don't know why you would need to use them in addition to using a hearing aid. And primarily, your hearing aid should help you in every situation. Would it be for watching TV or something?
Or music or computer.
Yeah, I mean, you could put them in over the top of your hearing aids and try to use them to listen to music. That's kind of the beauty of the new hearing aids, when you can listen to music directly from your phone or iPad if you have one. If you don't have those devices and you just want to listen to music, there's no problem. If you can put the earbud in over the top of the hearing aid, you can certainly do that.
I know my wife, Amy, this is Doug, my wife has her hearing aids programmed, for example, with her cell phone. So when she gets a call, it goes right into her hearing aid. And the same thing with her phone at work. Mail is programmed that for her too.
Yep.
So and then she can, through her Apple phone, she can listen to music and whatever. And then she doesn't need the earphones. She can just get it right directly into her hearing aids, and that works really well.
Exactly. So yeah, the only reason to use the headphones is if you don't have those devices or those hearing aids.
Sure. So right now, people could call you to talk to you about issues that are going on, and you can tell them whether or not you would be able to see them. And then once you open back up, again, your offices, and it was Waseca, not Wabasha, but it's Waseca, Owatonna, Austin, and Rochester. Is that correct?
Correct.
Okay. And what are the hours typically at those locations?
Well, typically, like Rochester and Owatonna are open 4 days a week from 8:30 to 5. But right now we have limited hours, so you'd have to call and ask. Austin is open 3 days a week, Monday, Tuesday, and Thursday. And Waseca is a half a day on Fridays.
Where do you primarily office out of yourself, Amy?
I primarily am in Owatonna, Austin, and Waseca. Doug Freeman is the other audiologist that works for me. He mans the Rochester office. Many people might know him from owning his own office in Rochester for many years. His father owned Bud Freeman Hearing Aids since 1964. So he's had a lifelong experience with hearing aids, and he's an audiologist. But I used to work for Doug, and now he works for me. He's got, oh gosh, I don't know, 30, maybe 40 years of experience with hearing aids. So very detailed man, very good. He's in my Rochester office.
Okay, cool. So folks, do we have any other questions before we kind of wrap things up here? You can take yourselves off mute and ask the question verbally if you want, or you can type it in, either way. If not, Amy, thank you so very, very much for taking your time to come and visit with us. I think this was very helpful. I tend to agree when you're doing something like this, to try to order it off the internet or off of a TV commercial, I think it's just ridiculous. You have to have a professional that can see you and that you can go back, because otherwise after the fact, who are you going to go back to get any of your questions answered or any help? So exactly. I think that is very important. But we really appreciate it, Amy. Did you have anything else you wanted to wrap up with?
I don't think so.
Okay.
I hope everybody found something of interest there.
I'm sure we did. I really, really appreciate it. And I appreciate all you folks. We had a good turnout here. We didn't have any idea what to expect doing this first Zoom session like this, and the turnout has been good. I hope that you continue to watch for sessions that we'll have coming. Just a quick review. I know in June, the plan was to have the Rochester Accordion Band come and entertain us at 125 Live. However, we're not going to be doing that in June because it's much more fun to be together when they're appearing and be able to enjoy them in person. So what we're looking at is we're going to have Kim Jawowski will be presenting one of her sessions from her Silver Series, Healthy Aging Strategies. And that's going to be, I believe that's going to be June 23rd, but we'll get something out to you. And we don't know yet, when we're going to be able to get together in person and when we'll continue, and if we'll be continuing to do this on Zoom, but we will let you know that as well. We want to protect everybody and keep everybody healthy, so we're not going to rush getting back in groups of people until we know that it is safe to do that. So, mark your calendar for June. Kim speaks very often up at Assisi Heights. She does a great job. Like I said, her program is Healthy Aging Strategies. And then the following month in July, we're going to have Joan Bachman. And she's going to be coming in to talk about the book she wrote. Her and her mother penned a book, If Only You Would Have Asked. And what that is a book to help us understand how to sit down and visit with the seniors in our lives. I know for one thing, I wish I would have spent more time with my grandparents talking to them before they passed on. I was in my 20s and I didn't stop and think about how important some of those stories are. But seniors have a wealth of information that they can pass on to us. So, so in June, Kim will be with us. In July, Joan Bachman will be with us. Everybody stay healthy. Joe, did you have anything you wanted to add?
No, I don't, and I'm not sure if I'm actually on mute here.
I can hear you.
Okay. No, I don't. I'm just glad everybody had a chance to be here for this. In fact, I thought it was great too. There's a lot of things I've heard that I never knew about hearing loss, and so at one point I kept thinking me and my wife need to be checked, and it turned out we just weren't paying attention to each other. So.
All right, everybody. Well, thank you. Stay safe.
Thank
God
you.
bless.
Thank you, Doug.
We'll talk soon.
Thank you.
Thank you.
Thank you very
Good
much.
evening, Angels. Thanks, Doug. Thanks,
Thank
Joe.
you.
Thank you.
Thank you.
Yeah.
Bye-bye.
Bye.